Okay, hello, everybody. Mars here. We are on our first episode of Uncharted Conversations. Welcome. For those of you who don't know me, I am Mars. I use they, them pronouns when referring to me. I started Uncharted Conversations last year with a group of the spokesmodels, and we're really just trying to have more conversations that we really need to bring to the surface and bring to light. And we really want to bring awareness to certain topics. So today's topic, we are talking about National HIV Testing Day and the fact that we can now have at-home HIV testing. We're going to kind of dive in a little bit more into the pros and maybe even the cons of that and talk about what that means and what it looks like. So I'm going to go ahead and turn the mic over to my co-host here. And yeah, we will keep going.
Hello, everyone. I am Jeffrey. I am with the HIV Stops With Me campaign, as is Marz, and I'm also um, uh, a community outreach worker for Care, and I'm a patient peer educator at Montefiore. And I really wanted to have this conversation because I've seen a number of patients that have come in for PrEP, and unfortunately, their status has already changed. I've seen a number of younger adults who have wanted to get on preventative care, and they find out that they're again. I see this growing number in especially the Latino and the Black community, and among women as well. So, which I'm going to share with you a few of those stats, but I'm going to also introduce Matt MacSweeney. We work together at Monty, and I'll let you introduce yourself, all right?
Sure thing. I'm a nurse practitioner, and I definitely have the pleasure of working with Jeffrey here at Monty with the infectious disease department, and we do some research as well. But definitely prevention, testing, that's all part of it. It's super. I'll leave it with that.
Awesome. Thank you so much. I'm so happy that you're here. Thank you for joining us and being on our very first Uncharted Conversations episode for the year. So as Jeffrey said, we are part of the HIV Stops With Me campaign. And if you go to hivstopswithme.org, you can find more about us and what it is that we do. We'll probably give you a little bit more information towards the end. Telling you a little bit about myself with this with HIV and testing. So I'm in upstate, I'm in Albany, just to put location to it. And so I'm not hearing as much about the at-home tests. So I would love to hear more. Because I know from a local perspective, I think it would be very beneficial to have them just because of, I mean, people like discreet. Discreet goes all ages. You know, you put the condom, you put the sexual health little packets together, right? The stuff that's
Yeah.
discreetly packaged goes a lot quicker than the stuff that's out and obvious, at least where I come from, where I've been at. So, you know, I know that at home test kits, I think would kind of change the game a bit because you can kind of discreetly go about it and kind of create your own comforts of home and such. But but yeah, I'm gonna pass it to Jeffrey. Do you want to talk a little bit more about these test kits? Here, I can tell you this. So the test kits, depending on when you get tested, there's an oral test, there's blood test, there's a lot of different types of testing that is out there. So if I'm not mistaken, please correct me if I'm wrong. The new at-home test kits are oral,
Or
are oral
only.
kits. Okay,
Or
perfect.
only, yes.
I'm going to go ahead and pass it to you, Jeffrey. Let's talk a little bit more about this.
Okay, well, the Department of Health and Mental Hygiene here in New York City deemed it appropriate that there was a lot of debate about whether people could test themselves at home and and obviously receive, let's just say, positive diagnosis. What was going to be of their mental state, how they're going to be linked to care. So there was a large debate, but I believe that. In two countries, they implemented these home testing kits, and the number of infections tremendously dropped. They are in, the race that we have for making all of I guess you can say, all of the world to rid ourselves of the epidemic. So after those numbers came out in that research, the New York Department of Health decided to implement it, and they have the community home test giveaway program. It is for New York City and its boroughs only as of right now. We will expand it. We do have a statewide program. That one I do not have the QR code for, but for this one I do have a QR code. So I'm gonna have you guys we're gonna freeze it here. Tell me if you guys can see this. Here we go. So I'm gonna hold it there.
I see it. Yep.
Okay. So if you guys need to pause this at this moment, if you want to receive a home testing kit, you can receive, I believe, you can receive one every 3 months, I believe, or 6 months. I'm still learning everything about this program because it took such a long time to get in touch with the individual for this program, because the Department of Health and Mental Hygiene hired about 2,500 employees or something along those lines, and they have a $1.6 million budget, so they're just spread out very, very far and wide. So it was quite difficult to get in hold of, and there's so many programs going on at the same time that it was difficult to get a hold of someone who, for this particular program, which is here in New York City, because I live here in Harlem and I work in the Bronx. I work with both the Latino and the Black community, and I personally know from my personal experience that the reason why it took me 6 years not to get tested was because of the fear and also the way we've been treated at many clinics and many, by the medical field and medical professionals, kind of like is a barrier. And the fact that, you have to go into a facility, and, many of these facilities have the name HIV related to them. So if they see you coming in or going out, it's like, my business is out in the streets. So this is why I am a strong supporter of the at-home testing. I believe that it should be readily available in all pharmacies, not just certain pharmacies. Right now, the price is at something around $56 up to $106. I think that's ridiculous. I think it should be the same value as a home pregnancy test, because in essence, you're doing the same thing. Why does it have to be so much? So
go ahead, keep going.
No, you completely agree.
By the way, if you didn't get the QR code, just keep an eye out in the subway. Jeffrey carries that thing with him everywhere.
Yes, I do. It's my new AI assistant, We know we are in AI. Okay, so you know that this is a program that's being based out of New York and surrounding boroughs. You have the QR code, which you can request one for yourself. There are going to be five questions. They are not, they're voluntary questions. You do not have to answer any one of them, but they do give us a general idea and help us map out what is happening and to whom in what demographics, so we can implement and create programs such as this one to actually meet the needs of the actual community. So those 5 questions would be helpful for us in that sense. And I'm going to go with a few, bear with me, as I am not a statistic kind of person, but I do have my assistant here who is. And in New York City, and what they consider New York is New York and the 5 boroughs as well. There were 1,396 new HIV diagnoses. This is the report as of 2020. There's another one that came out in 2022, but those were numbers we wanted to see before and after the pandemic. So I'm going to get there. There were 917 new HIV diagnoses, and total deaths were 1,933 deaths among people with HIV. And this includes people who died of other conditions, not just HIV related conditions. Um, of we have to give ourselves a lot of credit because since 2016 to 2020, when we actually began to truly say that we're going to rid ourselves of the HIV epidemic, our numbers have gone considerably down. We've gone from 2,200 new infections in New York City all the way to 2020, which I just mentioned, which was 1,396. So we got to give ourselves a pat on the back. Our efforts have been working and have been targeting the right demographic. Now it's the rest that we have to worry about. Unfortunately, that also comes with alarming news. Based on demographic, although Blacks make up 47% of the total, although Blacks make 22% of the population, they make up 47% of new diagnoses. Latinos make up 29% of the population, and they have 34% of new diagnoses. Whites represent 32% of the population and have only 13% new diagnosis, and Asian Pacific Islander make up 15% of the population and are 5% of the new diagnosis.
Wow, those numbers really put things into perspective on who it's affecting most, and I mean, what the toll was, and where we're at now. So thank you for sharing those statistics. That really thank you so much. It sounds like you're really breaking barriers down over in New York City and the 5 boroughs, getting those tests approved. I'm sure they're on their way up, working their way upstate. I know a lot of things get approved down in New York City first and then kind of, work its way up. So I'm super excited to hear that is now available, and there's so many benefits to it. You named just a few. And with the statistics, it's showing like we need these tests no matter what demographic we're in. The fact that there's any positive test says we need these tests to go out. So thank you so much for sharing that information. I'm going to go ahead and turn it over to you, Matt. Give me your take. Let's talk about what you think of the at-home tests.
Sure, I think it's a great idea, and it became super obvious, even more obvious, especially going through a whole pandemic. And that's always the thing that kind of stays in the back of your minds is, is it possible that the numbers dropped and improved because we're doing great work? Or is it also possible that a lot of people were just kind of like still haven't gotten back to the normal routine yet? We certainly did get used to having a lot of things brought to us and sent to our home and staying at home. And so at least that part of it should help facilitate people get out there. And so definitely to be able to encourage people to do this, I think I hope and I think because of all the extra measures we're doing, I think the numbers really, truly are going down. But ultimately, I think this is a great way to help get it out there. And it's not just New York City, New York State. The CDC actually even has some programs too. They have a plan to get 1 million tests out there. They call it the Together Take Me Home plan. So there's definitely plenty of resources out there. It really does help to open things up as knowledge, knowledge is power.
Thank you. Yes, I mean, it starts with awareness, and sometimes we need to put the awareness out there and make it a little more accessible even for people to take on it. I think of these at home, take home tests, and I think of the ability of having that like family support or a friend or someone there that can kind of emotionally even kind of help you process if that's what is needed at the time of whether positive, negative. It's still an experience that causes some stress for some people, and to be able to kind of do that in the comfort of your own home or the comfort of perhaps somebody that you feel safe with, something along those lines. I think that it's really incredible that this is starting. And I think, I do think the pandemic maybe even sparked this, right? Showing that you can give the at-home test kits, showing that, positive, negative, we can kind of trust those results for the most part, right? They talk about their, margin of, error or whatever, but for the most part, if you had a positive test here, that meant that you had COVID and you couldn't go somewhere. I mean, HIV is not the same. You're not going to be restricted to your home because you have HIV. Don't get me wrong there. But I think that it's great that they're finally applying that simple method. Honestly, I feel like any type of, well, maybe not any type. I'm not a medical professional, but I feel like having these types of tests available to be able to be taken at home in your own personal time and space, I feel like will open up many more doors to conversations that perhaps maybe would not have been had. I hear a
I
lot of, I hear stories of people when they get their diagnosis once, depending on the medical facility, they may or may not, answer questions. They may or may not give them support right then and there, they may or may not. And we hope they do, but in the event that they don't, I think it's great to have this other option available. Go ahead, Jeffrey.
no, absolutely. I agree with everything that you said. I believe that more people would get tested. More people would get tested actually between relationships. That we don't often do that when we switch partners.
That
Uh,
one.
Oftentimes, or when you have that occasional spat and the person goes away, and all of a sudden they come back. You know what I mean? But you had that weekend. You get what I mean? You still had that weekend in Miami. And it's just all of these things come into play. And again, none of these make you a bad person. None of these put you in a deviant category. Please erase that from your mind. Let's start removing the stigma right here, right now, that HIV is an accident. It just happened to you. And now, how do you address it and take care of it? And I think this is also self-care. You are practicing self-care the moment that you are getting yourself checked up at the doctor. That is all, because you're saying I matter enough to know about my sexual health, my mental health, about all parts of you. So this is all encompassing. If we're really going to take care of a person's well-being and you're going to exercise self-care, then it includes also your sexual health. You know, I think that, aside from the, taking out blood or anything like that, all tests can be pretty much administered at home. You can do them yourself, as the pandemic proved. Because I was checking my body. Do you feel something there? It was televisit. And I was like, do you feel something there? Okay, there's no lumps, there's no nothing, so you're good. Let me see the area. You can come up to the camera. I think everyone has done some sexting here and there. So sending pictures to your doctor, your provider, should not be a problem at all. It should actually be the practice in this day and age. Yeah, I just
Jeffrey
have.
got some X-ray glasses on Amazon, but they're not real X-ray glasses. Don't worry.
I,
The check is,
I,
he wanted to check out his bones, but
yeah, yeah. I guess I bet you with the technology as it's going, we will have the X-ray vision. We will be able to do the X-ray vision. But I want to kind of to know, like, what do you, I know there was a lot of controversy regarding people's mental health and receiving this diagnosis. You know what I mean? Like your body, let's just say I just took it. I don't know many people in the city. I'm new. One of the things I saw in my statistic was that the age bracket of newly diagnosed ranges from 13 to 29. That's kind of like the new normal. Yes, 13. And 13 is only because they can, because that's the time that they can receive sexual health without their parents being present. So that's the reason why. So maybe as early as 12 years old, they could have had it, and we don't know. But that number is pretty low for the city, at least. It's only one was diagnosed in the age bracket of 13 through 19. But I wanted to know, what recommendation would you guys what recommendation would y'all have to people who are going to take this at home to take care of their mental health? Like, do you have any suggestions of what they should do before going into taking the test, and in the after? Like,
one recommendation I would say is just test regularly. If you make it a routine to periodically test, you could test in between relationships, certain events by all means. But if you just start testing regularly and get yourself into the routine of doing it, and you can do it at home, makes it easier. Don't just do it once. if you're active, do it periodically, at least every 3 months. That way, you certainly get in the routine, and it also kind of gives you that extra reassurance all along. Because the longer you wait to go, the more difficult it will be to bring yourself back to do that test again. So as long as you stay on top of it and test regularly, you'll be in good shape. Uh, Another good thing to kind of mention about it, certainly the testing at home, am I doing it right? Um, and if, what if it is positive? Well, how accurate are they? What are the faults with it? Can you see a false positive? Does that meaning that can the rapid test actually show that it's positive and you actually don't have it? Yeah, it does happen. About 1 in 5,000. I have seen it happen. And ultimately what it means is if you do see a home test that is positive, it doesn't end there. The reality is you do have to go in and actually get a confirmatory test and actually check. Some people can have specific antibodies that could interact with it. And so ultimately, that knowing that it's a good thing to do, it's a great test, it's still very effective. You still should do some regular checkups, but ultimately knowing that it's not the end of the line, just with that test alone, is kind of important. Because if you do have any questions about it, anything does pop up, by all means, you can definitely, the testing is out there. Now, certainly by being able to do it at home, it increases the access, and that the access to the healthcare can definitely be a large part of the disparities where people may not have that access. So hopefully that opens it up. Yes, and actually getting into a clinic, and that can be a whole other challenge too. But at least you would have that extra knowledge and that extra idea of where to go with it. The last thing that I just want to mention too, it's why I would recommend testing periodically, is sometimes these things don't show up right away. So, this test typically, it might take 3 weeks. If you were exposed, it might take 3 weeks before this test would actually show positive, the standard home test. Because it can take a little while before certain reactions take place and certain antibodies develop. And that, once again, that's another good reason to keep testing periodically, and test, certainly if you have those moments. Don't forget to give a quick plug for PEP as well. If someone does have an experience where they really are concerned and there's super high anxiety about it, and by all means, there's hotlines for this, whether it's New York City, there's definitely hotlines for PEP, post-exposure prophylaxis to HIV. There's hotlines that can help with that. Urgent cares, ERs, they're all set up to deal with that, and at least get something in place right away, because that is a great way to potentially help prevent even after the fact, and ideally within 72 hours, within 3 days. So that's my last little plug. And knowing that we have ways to prevent it, and also knowing that we've come very, very long distance with HIV treatments. Jeffrey was mentioning some of the newer options, the injectable option where someone only has to actually come into the clinic every 2 months. They don't have to take a pill every day. There's new options that we're studying and coming out with and getting approval with. Potentially might even be an option where someone might only need to get treatment once every 6 months, twice a year. So we've come a long way. HIV is treatable. And that's the other thing that's important to remember, that, it's not, if you do see something on the test, come confirm it and be prepared just to know, for one, hey, this is not something that is the absolute end. There's definitely a lot of resources out there and a lot of things that are available to us.
Thank you so much. Yes, all of those are very good points. I think what I want to add to kind of what you've said and kind of tack on a little bit. For one, the frequent testing, right? Something that we say a lot is everyone has a status. You're either positive, negative, or you don't know. And with that, I don't know about you, but I would rather know. So I was born HIV positive. So just to go to kind of go with the you can live a long and healthy life. It's manageable. It's come a long way. I went from being, 10 years old on 13 different medications, 7 different doses a day, to now being on my one pill once a day. And, as long as I keep up on that, I'm someone who doesn't have to go to the doctor. I only have to go every 6 months, right? Like twice a year, essentially, I go for my checkups. But the individual testing, right? To speak to that, I think that everyone, I want to put a reminder out there for myself and for everyone else listening that, your sexual health is your own responsibility. You might think that, maybe you are in a committed relationship, it's just you, it's just them, you've got that circle, and it might be, maybe that is the case, but in order for you to really know, the only way to know is to get tested and to kind of determine for a fact whether or not you are, a healthy individual, or maybe there's some, other medications, maybe some other treatments and things that might need to come into place depending on, depending on the status that comes back on honestly any of these like take home tests, right? If you have a positive, you should probably call your doctor to follow up with that, or, local clinic, agency, something. I like was mentioned, I know access to care is very difficult in some places. You know, but I want to remind people that, your sexual health is your own responsibility. And by having these take home test kits, I feel like you can own that a bit more for yourself, despite, your situation, kind of like a pregnancy test. Like you can say, okay, I need to know for me what it is, or perhaps have a family member or someone there that can, help support you, as well as help you get linked to the care that you need. Um, I'll just add here, so HIVstopswithme.org. If you go to our website for the campaign, there's a page called resources. And so if you're not sure of where you can go get tested, maybe you are a recipient of one of these take-home test kits, right? And now maybe, you need more testing, or maybe it came back positive, whatever it may be. If you're looking for a place to go get tested or get, checked out physically, can check that resources page by county. It breaks down different agencies and different places that you can go to be seen and get tested. Some of them are drop-in, like, you can go day of. Some of them require an appointment. But in my experience, usually the site will be exclusive, and they'll tell you like, hey, you just call this number, or, you know, um, make this appointment here. But I think the pandemic really helped with that too. In the telehealth became a much bigger thing, right? You can kind of determine a little bit more proactively, I guess you could say, right? Whether or not that patient actually even needed to physically come into the facility and risk that exposure. With these tests, it's not saying risk exposure, but if you do come up positive, especially, in essence for HIV at least, it not untreated for, the longer you go untreated, the more time it gives the HIV, the infected cells, the CD4, and the viral load. So the viral load will go up and your CD4 will go down, because your CD4 is the good blood cells. And those viral, the infected cells are, they're eating away at the good cells. They kind of take over and mutate. And so if you're not on medication, the medication is what's stopping that from happening. It's creating a barrier, if you will. Please correct me if I'm wrong. I'm not a
No,
medical.
you're absolutely correct. You're
But
absolutely correct.
and that medication really helps create that barrier. And if you're consistent with it, it really is, it's almost second nature. I mean, I'm 35 years old, so I have been living with HIV for 35 years. And I especially seeing how things were back in the 90s, 80s and 90s. I was born in 88, so most of my life was in, the 90s. And I had received the AIDS diagnosis to begin with until it was distinguished the difference between AIDS and HIV, right? So I definitely have an HIV positive status, but I achieved undetectable at 15, and have stayed ever since. But it was because of, my parents were religious about putting my meds out there for me, and, taking on the table or sending me to schools that could help distribute it. But not everybody has that privilege, so all this to say, you have the ability, this gives people the ability to kind of take care of themselves and decide for themselves how they want to kind of go forward and own that status, positive, negative. I would rather know one way or the other. So I would encourage anybody to, if these tests are available, or if, you go to fair, right? There's a lot of different events and things going on, especially in the summer. A lot of times they'll have a testing van or something. They're not as discreet, kind of like Jeffrey was saying. They might see you come out, they might see you go in, but these kits can just make it a kind of a, I don't want to say a grab and go, but it can be sent to your house. So, but yeah, that's what I have. Jeffrey, do you have any more you want to add?
The only thing I would add is that you are absolutely correct. You are accurate in everything that you have said. Um, I just find that it is a big, somehow the Black and brown community are not getting as tested as regularly as possible. I would like to see that change. I believe that for whatever reason, I am Jeffrey, and I am 13 years living with HIV now. I got diagnosed in 2010. And that's presumably because I don't know of the number of years that I was a carrier of the virus, and that doesn't haunt me as much as how many did I pass this on to during those times that I did not know my status. I know that it is not quite as convenient to go into one of these facilities and get tested. I urge you strongly to really use the QR code, get your own at-home testing kit. You will probably see me around Harlem and other surrounding areas, all the way up to Washington Heights, handing these out at different times. We'll see how hot it is outside to determine where I'm going to be standing. But I will most certainly be handing these out all summer long. Into the early parts of winter, I'll try and pair up with some partners of local establishments here in Harlem and in Washington Heights. I will also be at the HIV National HIV Testing Day in Union Square, along with Amita Care, to provide some of these kits. And once we run out, obviously the QR code always works.
Awesome. We'll make sure to put that QR code, like, and add it to our post as we link this, so that hopefully it'll help you be able to use that code once again if it wasn't for some reason visible within the video itself. Do you have anything else to add, Matt?
Marz, I just want to actually highlight two of the points that you made that are extremely important. One, the sooner you start treatment, the better. Once again, if you can, the medications we have basically just take the air right out of the virus, in the sense that if you can suppress that virus before it even has a chance to do anything, you're in much better shape. And of course, yes, you're much less likely to pass it on. And the other thing I wanted to emphasize is that the resources are out there. If someone doesn't have insurance and they do a home test and they're positive, there is New York, especially in New York State, you will get care. There are many, many resources available because thankfully, New York State does some things that some people might complain about some things, or the city, but ultimately they reached an agreement that if someone has HIV, we need to make sure that they get all the care that they need and all the resources they need. So if ever you do have any concerns about a positive test, come on out, talk to someone, because there are resources. You will get the care and you will get the medication you need.
I'm glad that you pointed that out, because that was one of the main concerns I had, or during those 6 years. I had just moved to New York. My life was pretty unstable in terms of housing. I would rent a room in somebody's apartment, but I didn't know if I was, there was a lot of instability in my life. And I didn't know if I could afford it. Yeah, I have insurance now, but what about my next job? And you know what I mean? I was still looking to make my way into fashion. So it was like, I know this is not my place. So there was a lot of those questions. And I agree, New York it's one place that you can be sick, and you're going to be taken care of. I mean, it doesn't matter your gender, your race, your pronouns, nothing matters. It is only your well-being that matters, especially in the state of New York. I mean that for the entire state of New York, and especially for New York City.
I think California is okay too. But yeah, there definitely are other places where it's not the same. I
Yes.
definitely had plenty of patients who have left and come right back because they realize that those resources aren't there. But they are definitely here. And even if someone doesn't have insurance and they do have a positive test, they will get the care that they need to make sure that we can suppress that viral load and keep them healthy.
I do know, even through the state and other privately funded places, but there are health insurance policies that are built and intended for people with either chronic conditions and or HIV specifically. So just I don't know any off the top of my head, but just keep in mind that is those are also a resource. I don't know if either of you might know any of those, but I know I've seen them. I get employer sponsored insurance, thankfully, but being originally from Chicago and having some friends there trying to get even just mental health care, yet alone physical care, there's a lot of challenges. There's backlogs, there's waiting lists. Like who wants to be told who's in the middle of a mental break that's going to be like at least 3 to 4 months before you get your own, mental health professional to like help you. And here, yes, there may be a little bit of backlog. COVID kind of set us on a heightened excuse me, more people would be seeking out mental health now after COVID, I feel. But I think that this is the start of, I think, something better in being able to take these tests home, being able to do these, kind of make it more personal. And I think that I hope that this is the way of the future for all other types of tests. I hope that this is just the beginning. Because though there is the next step of getting linked to care after that, diagnosis of having that test in your hand, it's you have a minute to take a breath if you need it. You have a minute to take a beat and say, okay, tomorrow morning I will go, and make these appointments or whatever it may be, or I hope you have a support system. Um, you know, if not,
Yeah.
again, if you're not sure where to go or what to do, remember you can go to hivstopswithme.org. So we are here to help link you to care. Here to help you feel, and we're here to build community. We're here to talk about it. So thank you very much, Matt, for joining us and talking about it. And Jeffrey joining Uncharted Conversations,
No,
talking about it
thank
because you're all
you.
the way
Thank
down
you.
in Harlem. I'm in Albany, like so we're bringing it together. But we really just want to help end HIV stigma. And I think by what was it, 2025, they said?
2025, that's 3 years
Okay,
from now. But if I may plug one thing in,
please
if
do.
this one recommendation, in a piece of paper before you take the test, write what actions you will take if it came out negative and what actions you will take if it came out positive. So you have your plan of action already in place, regardless of the positive or negative diagnosis. That would ease a lot of anxiety. I know it would ease a lot of anxiety for me. And I just thought of it as you were saying, you were
That
talking about, I hope you have the support. It just dawned on me. If you already have a plan of action, it is so much easier. You just have to execute it.
that is
Generally, you
excellent
will have about
advice.
20 minutes to do it just in case you do things a little last minute because for the home test that you do, generally it's just an oral swab. You just take it, you kind of run it around the inside of your lips. There's instructions with it. And then you would put in a solution and you wait for it to develop. It takes 20 minutes. So you have that time to write your list out if you want. That's a good way to use that time.
Yes, that is an excellent suggestion. And thank you for explaining exactly how that test would be administered and how it would give you the results and everything. Thank you. So with that said, then I'm going to go ahead and end our show for tonight. Thank you both once again for joining us. First episode of Uncharted Conversations. And I hope everyone stays safe and be well. And this is us signing out.
Get tested.
Get tested.